We proceed to differential diagnosis, both for Western medicine and Chinese medicine, for cerebrovascular accident, stroke. For the Western differentiation, CVA means the sudden death of some brain cells due to lack of oxygen when blood flow to the brain is impaired by blockage or rupture of an artery to the brain. CVA is also referred to as stroke. The term wind stroke in Chinese medicine corresponds to 4 possible Western conditions. They all usually present a sudden onset of one-sided weakness of limbs with other features depending on cause and site of damage. 1, cerebral hemorrhage, which constitutes about 10% of strokes. There is weakness or paralysis, numbness, tingling, visual changes, slurred speech, difficulty swallowing, drooling, loss of memory, vertigo, poor coordination or balance, personality or mood changes, eyelid drooping, drowsiness, loss of consciousness. Second, cerebral thrombosis, which comprises about 50%. This is characterized by weakness or paralysis, numbness, tingling, visual changes, also slurred speech, difficulty swallowing, drooling, loss of memory, vertigo, poor coordination or balance, personality, mood changes, eyelid drooping, drowsiness, and loss of consciousness. The third is cerebral embolism, which is about 30%. There is weakness or paralysis, numbness, tingling, visual changes, slurred speech, difficulty swallowing, drooling, loss of memory, vertigo, poor coordination or balance. And finally, we have cerebral spasm. This is spasm of cerebral vessel that occurs on temporary contraction. This is the least severe of the 4 and usually followed by complete recovery. Now let's go to Chinese differentiation of CVA. Diagnostic questioning according to classification of wind stroke. We have 3 classifications. We have channel stroke, which is actually mild stroke from external wind affecting the channels only, causing no loss of consciousness, facial paralysis, dysphagia, hemiplegia. The second is organ or visceral stroke. This is severe stroke causing damage to internal organs, loss of consciousness, hemiplegia, facial paralysis, dysphagia, leading to disability or death. Either dissertation patterns with open mouth, limp hands, open eyes, enuresis, snoring voice, or stagnation patterns with clenched jaw or hands, subdivided as yin or yang. And then we have the sequelae, which is actually the result of the channel or organ stroke, hemiplegia, facial paralysis, loss of vision, and dysphagia. We can also do the diagnostic questioning according to mechanisms of internal wind. Now we have yin deficiency. There is hyperactive liver yang leading to wind. Attack can be sudden or catastrophic. Second mechanism would be blood deficiency. There is failure of blood to anchor the qi, so there will be tics, tremors, spasms. Third is heat. The internal heat congeals body fluids causing phlegm, and the heat becomes wind, carries phlegm towards the head. Then we have diagnostic questioning according to the 4 main etiological factors: emotional stress, excessive sexual activity, irregular diet, and physical overwork or inadequate rest. Now we have the Zhangfu patterns, the sequelae stage of organ stroke. Hemiplegia, the patterns are qi deficiency with blood stasis, hyperactive liver yang with blood stasis. So select channel points for limb. For dysphagia, we have wind phlegm or kidney and liver yin-yang deficiency. For facial paralysis, we do subcutaneous needling, stomach 6 to stomach 4, and stomach 2 to stomach 4, LI4, and lung 7. Thank you for your attention.